Thank you, everyone, for joining us today. My name is Gretchen Murphy. I'm a Senior Director of Communications and Advocacy with Alkermes, and I'm joined by my colleague, Michael Doan, Senior Director of Health Economics and Outcomes Research at Alkermes. Alkermes is a global pharmaceutical company focused on developing treatments for neurological and psychiatric disorders, including narcolepsy and IH. Today, we're honored to have Michelle Chadwick and Jessica Reinsmo join us. Just to note, this session is being sponsored by Alkermes. Michael and I are employees there, and Michelle and Jessica are being compensated for their participation in today's panel. So, as we think about the drug development process, there are many opportunities to engage with patients and gather their experiences, priorities, and needs throughout the process. Starting at the very beginning with preclinical and translational studies, we can ask what symptoms and impacts of the condition are most bothersome, and how can we measure them? When we move into clinical studies and we're testing the molecule in people living with the condition, we might gather feedback on how best to design a clinical trial and help to reduce patient burden. When we prepare to submit the application to regulatory authorities, we are also taking into consideration what patient-reported outcome measures can be included. And finally, when a medicine is approved, we have the opportunity to understand how to best communicate about the medicine to patients and prescribers. So those are all many opportunities that we have to gather patient insights, and how can we use that in meaningful ways? The first thing is to learn more about the condition that patients live with. Second, considering patient language, certain terms, phrases, and terminology can help us better understand what kind of measures to use as we are developing drugs. Third, we have the chance to learn about education and awareness gaps. And we can also understand the types of HCPs and specialists that patients see on their way to diagnosis. And finally, we can use patient-focused data to help communicate about the potential value or impact of these medicines. And so now I'd like to turn it over to my colleague, Michael, who will talk about an example of a patient-focused research study that was conducted in people living with IH, a study that was sponsored by Alkermes.
Thanks, Gretchen. Good morning, everyone. My name is Michael, and I am a health outcomes researcher. And so before going through some results from an interview-based study that we conducted, I just wanted to share a little bit about what a health outcomes researcher actually does at a pharmaceutical company. We are particularly interested in understanding what it's like living with both narcolepsy and idiopathic hypersomnia. We're interested in the types of symptoms that patients report experiencing, how frequently they occur, how bothersome they are. We're also interested in understanding the impact and the burden of living with these conditions across various aspects of people's lives. And as a researcher, I have to acknowledge the fact that I'm not an expert in what it's like to live with narcolepsy and idiopathic hypersomnia. And so health outcomes researchers partner very closely with patients to better understand the lived experience. We do this in a variety of ways, including interview-based research, where we can sit one-on-one and really listen to patient stories and gather really rich information about what it's like living with these conditions. We can also conduct things like focus groups, where we bring people together, we listen to their shared stories, and we figure out, what are some of the common themes and experiences among individuals, as well as what are some of the differences. In addition to this, we can also conduct survey-based research, where we collect really detailed information among a relatively large group of individuals. And all of this information is being collected for the purpose of really trying to figure out what kinds of outcomes we should incorporate within clinical trials. That way we're collecting information that's relevant, that resonates, and will be hopefully useful for patients, caregivers, as well as their advocates. So today I'll be walking through the results of, at a very high level, of a interview-based project that we conducted among 32 people living with narcolepsy or idiopathic hypersomnia. These were hour-long interviews where we sat down and asked really open-ended questions, letting participants share their stories and their experiences. In terms of recruiting for a study like this, it's really relatively challenging, especially for a condition that is rare. And so we used a variety of different methods to recruit the 32 individuals for this study. And that included physician referrals, it included posts to social media. But one of the things that we found in this study is the power of connections. And so individuals living with narcolepsy and IH knew other people living with the conditions, and they were allowed to recruit those individuals into the study, or something that we call snowball sampling. In terms of any kind of study that we do, we try to make sure that we obtain a representative sample of individuals living with these conditions based on age, gender, race, ethnicity. Though this was a relatively small study and we can't really look at differences based on those characteristics like we might be able to do in a larger study like a survey. So we're going to walk through 3 different topic areas. The first being the journey to receiving a diagnosis of narcolepsy or idiopathic hypersomnia. Some of the initial questions we asked in the interview was really around the initial symptoms individuals experienced, their journey toward receiving a diagnosis. Some of the key aspects that we found is that participants reported a lot of misdiagnoses along the way, including things like depression, sleep apnea, chronic fatigue syndrome. Individuals with narcolepsy and idiopathic hypersomnia also reported that their initial symptoms were things like excessive daytime sleepiness and fatigue, which we heard about yesterday is a separate experience from sleepiness. One of the most notable findings is that for half of the individuals specifically with IH, it took at least 10 years, if not longer, to receive a diagnosis, which is far too long. And individuals saw a variety of different healthcare professionals on their journey toward a diagnosis, including psychiatrists, neurologists, and their general practitioners before seeing a sleep specialist.
Thank you. And so I would love for Michelle and Jessica to be able to share their experience with their diagnosis. Michelle, would you mind talking a little bit about when you first experienced symptoms and the time until you received your diagnosis?
I first started experiencing symptoms, or when they first become noticeable to me and my family, was when I was 11. It was when I first started high school. I was first told that it was that I was transitioning from junior school to high school. So, it was different, and she was probably struggling with that. But it didn't make sense to my parents because I was considered to be a high achiever, and I didn't have any trouble with my schoolwork, even though I was struggling to wake up in the morning, falling asleep in class, coming home from school and falling asleep straight away. My mum would have to wake me to have dinner. So all of the symptoms were there, and I wasn't necessarily struggling with school. I just couldn't wake up for school. And so my mum started taking me to doctors and trying to get answers. But later, when I was in control of my own healthcare, I found that doctors had written down in their notes that I was just a child seeking attention, basically hypochondriac. So I knew that I had a challenge, but I was on my own now because I was an adult, and that's, my real journey started then, looking for a diagnosis or to find out what was wrong.
Jessica?
Yes, thank you. So my symptoms started when I was around 12 years old. I'd come home from school, immediately change into my pajamas and take a nap and then go off to dance practice. On the weekends, I was sleeping like 11 to 12 hours. And so my parents took me to the doctor, ran all of the tests, including mono. But they all came back normal. They just thought it was typical teenage tiredness. So that continued on. And I was diagnosed with depression at 18. And then I ended up leaving my first full-time job after college, partially because of all of the exhaustion. And that was when I decided to get some real answers. So I went to a primary care doctor at that point, and he diagnosed me with insomnia and referred me to a behavioral health specialist who told me to track my sleep and told me to naps, which did not end up happening because I need naps to function. So eventually I was referred to a sleep specialist, and I had the polysomnogram, the MSLT, and then was diagnosed with idiopathic hypersomnia. Ironically, when I was in college, I was minoring in psychology, and I kind of diagnosed myself with IH back then. But yeah, I mean, it took 12 years until I was diagnosed.
You both sounds like you have a similar journey, and one that is also reflected in some of this research, just with the length of time and also the self-advocacy that you needed to, having seen so many doctors, but knowing just in your core that something wasn't right.
All right, great. So moving on to the second theme, we in the interviews had asked questions about the different symptoms that individuals reported experiencing. Of all 10 individuals with IH, they did actually report experiencing cognitive impairment. And this encompassed a variety of different things, including memory issues, problems with word finding, problems paying attention, concentrating on information, and just this overall sense of fogginess that we heard about yesterday. In addition to cognitive impairment, though, excessive daytime sleepiness, of course, the hallmark symptom was also very common, as well as fatigue, again, a symptom that is separate from sleepiness that patients were able to really talk about that also negatively impacted them, in addition to that hallmark symptom of IH. There were a host of other symptoms that patients experienced, but by and large, the most common and bothersome included cognitive impairment, fatigue, and sleepiness.
Jessica, we'll start with you this time, if that's okay. So yeah, could you talk a little bit about your experience with excessive daytime sleepiness as well as other common symptoms and maybe how they're reflected here?
Yeah. So, in addition to the constant sleepiness every single day and always being sleepy, I think brain fog and cognitive dysfunction is one of my major symptoms. I'd walk into a room and completely forget why I was there, or I'd lose my train of thought in the middle of a conversation, which can be extremely embarrassing, especially in the workplace when I'm talking like partners or stakeholders. Another major symptom for me is sleep inertia. It takes me about an hour to fully wake up, and I rely on multiple alarms to wake up on time. My mom had to physically shake me awake because nothing else worked. So yeah, all of these symptoms are not something that I can just push through or sleep off. And I found ways to adapt, but not every day is the same. And, some days are harder than others.
Michelle, when we spoke, you were talking about sleep inertia and sleep drunkenness. Can you talk about those experiences for yourself?
Yeah, that probably is the most challenging symptom for me. Brain fog is difficult, and I struggle with that throughout the day. But sometimes for me, waking up in the morning, the sleep drunkenness and sleep inertia is so difficult, it doesn't leave me. So it's like I wake up with brain fog and I'm with it all day. But yeah, like Jessica, multiple alarms, needing somebody to wake me. And then when I am finally upright, the sleep drunkenness is quite a challenge. It affects speech. So you know what you want to say, but you can't get the words out. You can be unsteady on your feet, which is where they get the term drunkenness from. You actually feel not in control of yourself. So you have to be careful about picking things up or going downstairs or, you know, driving even. So I had to set up, you know, getting people to take my kids to school, for instance. So I could drive later on in the day, but I just couldn't do it in that hour or two after I woke up. So waking up is definitely the hardest thing I do every day.
All right, so we first spoke a little bit about the challenging journey to receiving a diagnosis of idiopathic hypersomnia or narcolepsy. Then we talked a little bit about the common and bothersome symptoms that individuals report experiencing. The last portion of the interview project that we had conducted looked at the broader impacts of the condition. So how did the condition affect the individual, him or herself? How did the condition affect family members and other individuals in their lives, as well as other aspects? And some of the most common impacts that were reported, all participants reported experiencing problems with school as well as employment, either staying in school, kind of achieving what they wanted to achieve, as well as problems being able to be productive at work, for example. Mental health was also a very common impact that was described, and this ranged from experiencing symptoms of depression and anxiety due to the condition itself, but also things like stigma came up very frequently, or feeling that other individuals just didn't understand what it was like to live with idiopathic hypersomnia or narcolepsy. There are a host of other impacts that participants reported. And one of the benefits of conducting interviews with individuals is that we can obtain these rich quotes that we have up here.
Thank you. So Michelle, would you mind talking a little bit about some of the greatest impacts that you feel IH has had on your life, whether, school, work, and activities of daily living?
Well, while I started off in high school doing rather well despite the symptoms, things did get very difficult. And that the biggest challenge was not being able to wake up in the morning and having that slow start. So I just continued to be late for school. And as a result of that, my schooling did suffer. Once in the workforce, it was the same. Struggling to wake up in the morning, struggling to get going. The sleep drunkenness was such a challenge that I might not get to work at all. And that was a cycle for me. I would find myself embarrassed about not getting into work on time, embarrassed about not turning up to work at all. You're expected to call in sick, but if you're asleep, you can't do that. So that really reflects bad on your employers, because they think that you're doing it on purpose. Just because you're sick, you can't ring. It doesn't mean you can't ring in sick, but it does if you're asleep and if you can't wake up. But you can't explain that to them because they don't understand you can't wake up. Everyone can wake up, but when you literally can't, you can't. So it was from one job to another job to another job, which meant establishing a career was very difficult. It doesn't look good on a resume when you have a string of jobs. However important the job at the time was, a string of them doesn't look good. So that was basically my life until I got to the age of 40, and I'd had 2 children by then. And like we spoke about, it became a matter of, do I dedicate what wakefulness I have to my 2 children or my career? And well, that was a no-brainer. So my family won out. But being a mother had another set of challenges, which I wasn't prepared for. But yeah, I'm grateful that I am a mother now, but it was not easy. I'm not even sure that I probably would have chose that path had I known, because I wasn't diagnosed until after I'd had my 2 children. They were toddlers at the time.
Jessica, could you share a little bit about your experience as well?
Yeah, absolutely. So IH impacts almost every aspect of my life, but especially work, daily routines and my mental health. So I've been working part-time for the past 6 years. That's not what I originally wanted. I wanted to work full-time, but I really can't manage full-time hours. I need naps to function every day. And luckily, my boss understands that and lets me split my day. So on the hybrid days, or I'm sorry, I do work hybrid, but on the in-office days, I'll go to work in office, come home, take my 4 to 5 hour nap, and then finish out the workday there, but at home. But that kind of flexibility is extremely rare. And it's taken years to try to find someone who will do that for me. And then because of my limited income, I'm still living with my parents because I can't afford to live comfortably alone at this point. Now, with daily routines, like washing the dishes or doing my laundry can wipe me out for hours. I eat fast food a lot because cooking is exhausting. That also goes the same for exercise. Instead of boosting me up, it drains me. I really don't know how I'd manage without my parents because they help with meals and chores. So I'm extremely grateful to them. Weekends are a little easier because I don't have a lot of responsibilities and I can sleep in. And then like the hardest day is probably Mondays for me, just because my sleep schedule is kind of thrown off and it's kind of starting from scratch all over. And then mentally, I am doing much better now, but that took years of therapy and attending the Living with IH USA support group and accepting my diagnosis. Before my diagnosis, I was dealing with depression, constant exhaustion, and lots of guilt. I lost friendships because I kept canceling plans all the time. Family members didn't always understand why I had to miss important events, even after my diagnosis. So even though it was validating to get diagnosed, I also had to deal with grief because I knew that my lifestyle and my energy were never going to be what it once was. So yeah, it impacts everything. But I'm learning to set boundaries and prioritize my health, even if it's hard or disappointing to others.
Thank you for sharing that. We're going to move now just to a couple more questions for Michelle and Jessica, just more about your advocacy efforts and any advice that you have for members of the IH and narcolepsy community. So Michelle, we heard yesterday you share a little bit up on the main stage about Hypersomnolence Australia. And it's been more than 10 years since you founded that organization. Can you talk about your motivation to start that and what that journey's been like?
Yeah, after I was diagnosed, like most people do, they go online and they want to research and learn as much as they can about their condition. And with IH, it's necessary because your doctor doesn't usually know a lot about it. So you leave the diagnosis with little information. So the first thing you do is you go online. But 13 years ago, I realized that there wasn't anything online about IH. There wasn't anything, there wasn't any information. There wasn't anything that explained what it was. There was nothing on social media. I started to wonder why. Why is there everything? You can see everything online, everything on Facebook about every other condition, but there was literally nothing about IH. There were some research papers behind paywalls, and that was about it. So I got together with the few people that I could find online that had mentioned IH, and we started to talk about starting a international organisation because the few people were scattered. There was a couple of people in the UK, in Australia, in the US, but there were challenges with that, having a international organisation. And I just decided, well, I'll start one. And that's how Hypersomnolence Australia began. And in that same year, I started the Idiopathic Hypersomnia Awareness Week. And that brought together the global community. And it grew and it grew. And we found more people, and we started to realize that although rare, there were a lot of people out there, and they did want support, and they did want to be seen, and they did want to be recognized, and they wanted an organization to represent them. So we just kept going. And today we now have support groups in the US, the UK, Europe, Australia, New Zealand, and Canada, and even in Japan.
It's amazing. You've had quite an impact, and it's really come so far. So thank you for your efforts. And Jessica, I know you are involved with the Living with IH support group in the US. Can you talk about how you got involved with that?
So about a year after my diagnosis in 2019, I was looking for support, and I found Idiopathic Hypersomnia Awareness Week. And I saw that there was a support group for Australians. So I emailed Michelle and was like, hey, can you create one for us US people, please? And thankfully she did. She found some admins, which was so helpful. So I've been attending on and off for the past 5 years. And as I became more connected, I started creating some awareness graphics for Idiopathic Hypersomnia Awareness Week, which we created like so many graphics this year.
They look great.
Yes. And, about 3 years into the support group, one of the admins invited me to become an admin as well. So I manage behind the scenes communications, organize the monthly meetings. And it's just incredibly rewarding to be a part of the IH community and support these advocacy efforts.
And this is the first time that you two are meeting in person, is that right?
Yes.
Yeah. So my last question, and Jessica, we'll start with you if that's okay, is just any advice that you have for people listening, whether they're newly diagnosed or further along on their journey.
Absolutely. So, for like patients and caregivers, I say do as much research as possible. One of the biggest challenges with IH is that it's so rare, and that the information that we're usually given is not detailed enough to manage and understand it. And then for patients, like finding support is crucial. Finding someone regularly who can understand you is incredibly validating. So whether that's therapy or a support group, it will be crucial and so helpful. I've heard it many times in the support group, and also myself, I've experienced it myself, how validating it can be. And then also for patients, be so gentle with yourselves. Like, you are trying your hardest, even if it goes unnoticed by others. And then for caregivers, I please ask that you stay open-minded and kind. Supporting someone with IH can mean navigating difficult moments. So whether that's like finding the right medication, dealing with insurance, dealing with low energy levels, emotional challenges, or just the frustration of having a chronic condition, patience and compassion can go a long way.
Michelle.
I second what Jessica has said about being kind to yourself. I have learnt over the years to do that, because I certainly wasn't kind to myself. I had high expectations of myself, and I had allowed the expectations of others to control the way that I had expectations of myself. So that is really important. I can't stress that enough, that you need to block out the noise that's around you, get rid of the toxic people in your life, focus on your well-being, because you can't give to anybody else if you are not looking after yourself first. And one of the ways that you can do that is to get involved in your community, because they will give you the strength to fight for yourself. Another thing I'd like people to understand is that As frustrating as it might be to have a doctor that doesn't understand your condition, it's distinctly possible that you're their only IH patient. So you end up being the expert, and connecting with your community will help you become that expert. I would also say, I've even lost my train of thought now, but yeah, I'll get it together at the time.
That's great advice. Well, thank you again so much for being here and being so open and transparent about your experience. I think we've all learned a lot, and we'll take that with us as we go forward. So thank you.